Good morning, ladies and gentlemen, members of the media. Thank you so much for joining us for the Ministry of Health and Wellness's digital press conference for Monday, January 25, 2021. We have with us the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. He's joined by the Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, the Chief Medical Officer of Jamaica, Dr. Jacqueline Bisesa McKenzie. We also have with us Dr. Karen Webster Carr, the Principal Medical Officer and National Epidemiologist, and Dr. Nadine Williams, the Director of Health Services Planning and Integration. We'll begin this morning's press briefing with the update from the Minister.
Very much. Thank you very much, Stephen. Ladies and gentlemen, members of the media, good morning, and thank you for joining us for this digital press briefing as we continue to update the nation on the latest developments as it regards to COVID-19 and Jamaica's response. The first item, upon the recommendation of the Ministry of Health and Wellness, the Cabinet has decided to enforce enhanced COVID-19 measures in the parish of Manchester. This will take effect today, Monday, the 25th of January, for a period of 2 weeks ending Monday, February 8th, 2021. Manchester has seen a rapid increase in cases, with 125 new cases between January 10th and 24. In addition, the cases are spread across the parish with over 30 communities affected. There is non-compliance to infection prevention and control measures, as many persons are not wearing masks, and there is more crowding and gatherings that are observed on the ground by the surveillance team. The parish of Manchester accounts for some 11.3% of all confirmed COVID-19 cases in the last 2 weeks, and presently 5.3% of the total confirmed cases ever for the country are in that parish. The positivity rate for the parish has been the highest in the last 2 weeks, which is now over that period has been approximately 28% or 27.8%. And it is 3 times the national positivity rate, which stands at some 10.8%. So based on testing, based on surveillance, Manchester is far ahead, unfortunately, in terms of positivity rates, over 3 times the national average. As it relates to death per population, Manchester ranks 9th overall. The health team in the parish has reported an increase in the number of persons presenting with symptoms of COVID-19 at health centers and the hospital. Contacts of these persons are also found to be positive when contact tracing is carried out. There is also an increase in hospitalization of persons in the parish with respiratory illnesses, 85% capacity. This is compared to 78% for the Western Regional Health Authority, 61% for Sierra, and 56% for the Northeastern Regional Health Authority. So there is an increase in hospitalization, and these are the indicators that we use to determine whether or not we need to increase the restrictions. Once we see positivity rates going up, hospitalization going up, and this, of course, is in keeping with attempting to not be overwhelmed the public health system, because that would lead, of course, to persons not getting care. Of note is that our major hospitals in the region are at the amber and red alert levels. Mandeville Regional Hospital, 76%, and Percy Junior Hospital, 83% occupancy. Again, we have to manage those numbers so that we do not become overwhelmed. In addition, there has been an uptick in the number of persons who have been found to be positive for COVID-19 from general hospitalization surveillance, that is, persons who are admitted to hospital for another condition, when routinely tested for COVID-19. Those persons are found to be positive for COVID-19. Therefore, ladies and gentlemen, in keeping with the Disaster Risk Management Act, the curfew hours for Manchester will begin at 7 p.m. this evening, that's Monday the 25th of January, and end at 5 a.m. on Monday, February 8th, 2021, with persons allowed to move about between 5 a.m. and 7 p.m. each day. During the period, gatherings in a public place should not exceed 10 persons, and markets and vending in public arcades and public transportation centers are only allowed between the hours of 6 a.m. and 6 p.m. Additionally, between January 25th and February 8th, 2021, public transportation authorized by the Transport Authority Act will be allowed to operate between 4 a.m. and 8 p.m. and no passengers being transported between the hours of 4 a.m. and 5 a.m. and 7 p.m. and 8 p.m. I want to also point out that the ministry has concerns for the parishes of St. James and St. Anne, and we continue to monitor those parishes on the ground using our various public health teams at the level of the primary health care system as well as the parish public health team. And we will keep the country updated, but want to remind those persons, residents in those parishes, as well as the country, to be mindful of the protocol. And to take particular caution as we move around in protection of ourselves, but also our families, communities, and by extension, parish. I want to comment briefly on private labs and COVID-19 testing, which has been a talking point over the past week or so. The ministry notes with concern the number of pop-up testing sites that have been reported in the media over the past number of weeks. A number of persons now offering tests of all types and using methods that in some instances are not validated, and charging fees too, I may add, that are astronomically high when compared to the cost of these test kits. And this is information that we have in the ministry, meaning the cost. Although we recognize the right of a doctor to perform some tests, there is also a duty of care that must be attained to ensure health and safety of all concerned. As such, the ministry wishes to reiterate the need for appropriate certification and accreditation of private individuals and companies that want to carry out testing for SARS-CoV-2 or COVID-19. The ministry continues our private-public partnership as it relates to testing for COVID-19. Currently, we have 7 private labs with 10 locations providing antigen testing, and 5 private labs utilizing 6 locations across the island that offers PCR testing. And before I name these entities, I want to say that you may recall that in terms of travel, and the U.S. in particular, there's a requirement for either the antigen or PCR testing, and we have these labs that are available and can provide these tests for a fee, the private labs, of course. For Canada and the UK, where travel is allowed, the PCR testing is what is required within 3 days of travel. There are no options in terms of private entities that can provide those tests. And I want to say that recently the University Hospital of the West Indies is now in a position, beyond offering as part of public health, to also offer private testing to the public, so testing for a fee. In terms of the entities, the 7 entities for antigen testing are Microlabs Limited in Kingston, Mandeville, and Montego Bay, Biomedical, Caledonia Labs, Kingston and Montego Bay, Winchester Surgical and Medical Institute in Kingston, Bay West Hospital, St. James, Hospiten in St. James, Andrews Hospital in Kingston, and Technology Solutions Limited in Kingston. Now, the spread is there, but it is noted that the key parishes are Kingston and Montego Bay and St. James and Kingston. I think in the weeks coming, there is going to have to be a discussion as it relates to how that spread can be enhanced, whether with other entities or working with the existing entities that have the authorization, if you will, based on an assessment of their process. Private labs conducting antigen testing are reminded to submit their test results via email to agdata@moh.gov.jm. Is that agdata? Okay, at moh.gov.jm. Just to say there is an obligation as part of the arrangement for test results to be submitted or uploaded as part of our surveillance arrangements. And it's a requirement, and so I want to urge private labs to comply with that requirement. For PCR testing, the entities are Carigen, and Carigen works also, they are located at the University Hospital of the West Indies, but they also work with microlabs who will collect samples and then they do the testing. So if you want PCR testing, you can also go to microlabs. MD Link in Kingston, Biomedical, Caledonia Labs, Kingston and St. James, Bay West Hospital in St. James, and Technology Solutions in Kingston. So a number of private entities now able to offer PCR testing. We'll continue to work with other private partners who are interested in working with the ministry to expand the testing capacity in the country. Organizations that are interested can contact the National Public Health Lab. That's the National Public Health Lab, headed by Dr. Hamilton, for further information as to how they can qualify to be a part of offering these tests. The ministry also wishes to advise private labs to visit the JANAC website, and JANAC is based in the Ministry of Industry, Investment and Commerce, Minister Shaw, and to participate in the enhanced accreditation program for medical labs. Interested private labs should visit the JANAC website at www.janaac.gov.jm. That's www.janac.gov.jm to access more information and to download the application forms for registration. The Ministry of Health and Wellness supports this initiative of the Ministry of Industry, Investment and Commerce and encourage all interested parties to register and to get accredited. A quick update on vaccines. You may recall that last week I tabled in Parliament, which is last Tuesday, the Interim National Vaccination and Deployment Plan. It outlines the overall strategies for the deployment, implementation and monitoring of the COVID-19 vaccines in country and is developed in a way that ensures alignment and integration with the national COVID-19 response and recovery program. The plan will be placed on the website of the Ministry of Health and Wellness at www.moh.gov.jm, and I certainly encourage all Jamaicans to visit, to review the plan, and if you have questions, you can pose those questions via the website or through any of our local entities or health centers, hospitals. This plan is developed and based on information which is currently available and the assumptions the government is able to make based on the current available information. There will be future updates to the plan as new information becomes available. During the coming weeks, the ministry will also host a town hall meeting on the plan, and we invite all Jamaicans to participate in this forum where the plan will be discussed and critical questions will be answered related to the vaccination and the plan's rollout. In terms of governance structure, multi-sectoral and multi-stakeholder governance structure has been established to lead the coordination and deployment of the COVID-19 vaccine. This structure includes the previously announced establishment of a National Vaccine Commission to provide strategic and technical oversight to develop and implement the national deployment and vaccination plan for the introduction of COVID-19 vaccines in Jamaica. So we want it to be as broad-based as possible so that the stakeholder bodies throughout the country are aware, and the country is aware as to the plan and what is going to be done. A national coordinating committee has also been established to design, plan, and provide leadership to the field on all activities related to vaccine introduction. The NCC will guide the priority actions and engage in an ongoing risk assessment so as to ensure that the plan remains relevant. The NCC will be supported by 4 subcommittees: the Parish Medical Officers of Health and the Parish Expanded Program on Immunization Coordinators. The NCC will have responsibility for providing updates on the ongoing assessment of the safety, immunogenicity, I think I got that right, yes, efficacy and duration of protection of candidate vaccines. We have already begun to sensitize our healthcare team through several sensitization sessions held with over 200 healthcare workers. The sessions have included information on the Kovacs facility and the vaccines and the interim national vaccination and deployment plan. So we're addressing our internal stakeholders. The ministry has also begun the process of recruiting a communications consultant to lead the process of a public education campaign. While that process is ongoing, we have started the sensitizing the public on fundamental vaccination information and advertisements in the print media and on social media. In the coming weeks, we will also roll out a CAP survey to assess the knowledge, attitude, and likely level of acceptance with respect to the vaccine. A lot of work, ladies and gentlemen, is being put into this plan, and as much as you see, there's a lot more taking place that you will not see in terms of the coordination to ensure that the plan can be implemented efficiently. In terms of an update on the Kovacs facility, we have been advised that the vaccines that would most immediately be available to us under the Kovacs facility will be the AstraZeneca and the AstraZeneca Serum Institute of India. This availability is pending emergency use listing from the World Health Organization. The expectation remains that it will be available for delivery during the first quarter, as we have said, meaning in April. The AstraZeneca vaccine requires cold chain capacity that we already have in country, and transportation and storage of these vaccines would be reasonably accommodated. Thereafter, the next vaccines that become available through the facility would be the Novak, Johnson & Johnson, Janssen. And the same process would follow in terms of what is required, in terms of educating or informing the public and coordinating with our various stakeholder groups. In terms of the arrangements outside of Kovacs, further to the announcement that Cabinet had given approval for the Ministry to source safe vaccines from other facilities outside of the Kovacs facility, I am pleased to announce that meetings have been held with the ambassadors of China, Cuba, and India respectively. During these meetings, we have expressed Jamaica's interest in obtaining vaccines from those countries once they become available and are safe for our population. These countries are well advanced in the research and clinical trials of their vaccines. Our number one priority, ladies and gentlemen, remains the safety of our people and the government through the Ministry of Health and Wellness. Therefore, we will continue to seek out all avenues to ensure the best health outcome for every citizen. In closing, I want to again underscore the importance of members of the public adhering to the COVID-19 protocols that we have put in place to reduce the spread of the virus. I think Jamaica remains in a state of readiness to respond, but we are also in community transmission, and every Jamaican has the responsibility, therefore, to cooperate with the government to take personal responsibility to protect themselves, their loved ones, and their communities and the country by observing all the infection prevention and control protocols, including the physical distancing of 6 feet, the staying at home if you don't need to go out, the avoidance of crowded situations, the frequently washing and sanitizing, the wearing of masks, and obeying the quarantine and isolation orders as given by the public health authorities, and of course adherence to the provisions under the Disaster Risk Management Act. For the citizens of Manchester, my birth parish, I want to say we are not taking this decision lightly. It came out of extensive deliberations by the Cabinet Subcommittee on Friday. We spent several hours going through the numbers, looking at the risks, assessing the actions to be taken, chaired, of course, by the Honorable Prime Minister, but involving several ministers. And the decision we have taken is in the best interest, we think, of the parish, because of the positivity rate, because of the challenges with our public health system to respond. So we want to encourage you, abide by these decisions, and remember the changes that we seek as we move back to normality will largely depend on you, the citizens of the parish. It is up to you to observe the protocols. It is up to you to encourage others to do the same in your own protection and in the protection of your family, community, parish, and by extension, country. I intend to be in the parish sometime this week, I think on Wednesday, where I will meet with the health team and will move around a bit in some of the areas that are of concern. That's to raise the awareness, the attention, and to provide encouragement, particularly to the health team on the ground who have been working diligently at this. But ultimately, my one visit or 2 visits won't make a big difference if Jamaicans do not abide by the protocol. So, again, I encourage you to do this. At this time, I'm going to invite our Chief Medical Officer, Dr. Jacqueline Bisesi-McKenzie, to provide us with the latest surveillance update, including what's happening in Manchester. Dr. McKenzie.
Thank you, Minister. Good morning, everyone. We would have updated at 10 o'clock this morning our website, and we would have added 133 new cases. 1,117 tests were done yesterday. We had 2 new deaths, unfortunately, and 17 recoveries. That brings our case numbers now to 15,012 confirmed cases. We have 627 imported cases, with 14,385 locally acquired cases. As you note, we have 1,106 confirmed cases between the 10th to the 24th of January. And this would represent an increase over the last couple of weeks in the number of confirmed cases that we have been seeing. In the maps beside, you would have seen that if you focus on Manchester, we would have had 125 newly confirmed cases over the last 2 weeks, which if you look at the other parishes outside of Kingston and St. Andrew and St. Catherine, you would recognize that it is well above the other parishes. Next. This is our COVID rates by parish, or number of cases per 100,000 population. Again, you can see that Manchester at 65.1 per 100,000 is above all the other parishes, and again this is something that we have been noting the increase over the last 2 weeks. Here is our national epidemiological curve, where you can see that according to the numbers that we have mentioned before, that there has been a gradual increase in the number of cases over the month of January. This is our weekly positivity rate. Last week our positivity rate was 10.8. This again shows an increase. The previous previous week it was 9.5, and the week before that at 8.8. So we definitely see a gradual increase in the number of cases. So far for this week, which would only be one day, we have an 11.9% positivity rate. And this shows the communities across the island that are affected. Again, quite a bit of communities. If you note again the parishes in the central part of the country, that's we're seeing a lot of communities being affected. This shows the number of deaths that we have been seeing, and a slight increase again in the number of deaths that we've been seeing. And we've seen a drop recently, but too early to say if that is a final number for that period. This is the age distribution, again showing that the over 60 age group, as you get older, the number of deaths increase per number of cases. So you will see that above 60 to 69, 70 to 79, 80 to 89, and the greater than 90, we have the highest case fatality rates. And this is the deaths per parish. Again, you can see that we have deaths occurring right across the country. The parishes that we're seeing most deaths per number of cases would be Westmoreland, St. James, Trelawney, and then St. Anne, St. Mary, and St. Catherine. So just to overall, you can see that as we had predicted at the latter part of the year for 2020, that there would have been an increase in the number of cases that we're seeing that would have gone into January. And we're certainly seeing that we're seeing overall an increase in the number of cases, although a very, not a rapid increase, but definitely increase. The situation in Manchester has really risen to some prominence in our discussions over the last 2 weeks, where you see that the number of cases over the last 2 weeks surpasses the number of cases in the other parishes. And this is, next slide. This is the Epicurve for Manchester, where you can definitely see the concentration of an increased number of cases towards the end of January. And right across the parish, what we're seeing are that several different communities are being affected. This slide shows over the last 6 weeks the number of cases per community in each week, number of new cases that would have been recorded in each community. And when you look at it cumulatively, look at the next slide, we can see that quite a significant number, over 30 communities right across the parish are affected. So one, we have an increase in the number of cases generally, and we have an increase in the number of communities that are being affected. And these are some of the communities that we can see that we are having cases in, with the largest number of cases in the Mandeville Central area. Next. And right across the parish, you can see that we are having cases. Now, there are a small number of cases that are occurring right across the parish, but importantly, what we are seeing is that many of these cases are symptomatic cases. And so they are presenting to the health centers, they are being discovered in the hospitals through the general hospital surveillance. And so the danger, of course, is that these persons, having been symptomatic, would be affecting other persons. The level of exposure within the parish, right across the parish, we are estimating at this time is high. And so we really do need to cut down on that, the risk of exposure, especially to the vulnerable populations. Next slide. That's it? Okay. And so these are the reasons why we would have risen in terms of our alert level for Manchester, and would now be recommended and was discussed by the Cabinet and agreement that we would have increased restrictions in Manchester. Again, just to emphasize, the increased number of communities right across the parish we're seeing cases, not just cases coming out of surveillance, community surveillance, but cases that are coming out of persons presenting to health centers, to hospitals with symptoms, suggesting that there is a high level of exposure within those communities, and we need to act now in order to stem that exposure, to prevent persons from spreading and to allow them to go through the incubation period without infecting other persons. And that is why we need to have the increased restriction over a period of 2 weeks, so that we can stop the transmission during that 2 weeks and therefore decrease the number of cases. Similar situation that we had in Westmoreland, where we had the increased number of communities, increased risk of exposure right across the parish, and it was important for the incubation period of the virus just to stop persons from moving so that we could stop the exposure and certainly decrease the risk of hospitalizations. Again, Minister had spoken about the level of hospitalization presently in the parish of Manchester. We actually have 2 hospitals, Black River and Maypen Hospital, that are over 95% occupied. And then we have another 2 hospitals, Manchester, Mandeville Regional Hospital and Percy Junior Hospital, that are in the amber zone between 75 to 85% occupancy. And this puts us at risk. It puts the region at risk. If the number of COVID cases increase, the number of hospitalizations will also increase, and we will run out of space to put these persons. So it's very, very important at this time that we just stop the movement, stop the spread, and just allow for this 2 weeks, this incubation period, to pass so that we can have persons being protected from exposure.
All right, thank you very much, CMO. Okay, so I think that's it for now. I think the information is there in the public space. I think the last few slides, which zeroed in on Manchester and the communities in particular, is worth taking note of. I'm going to ask, well, in the usual manner, I know our communications team will put that up on social media, on the website, and otherwise. But it's important that persons living in these communities, and indeed in the parish, take heed. And for the rest of the country, St. James, St. Anne, very important to manage the challenges that are there, and let's make all the efforts that we can. So at this time, we're going to go now into questions. Stephen?
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose questions to our team. We'll go to Janet Silvera from the Gleaner.
Thank you very much. Good morning. My question is in relation to persons who have had the virus. I would like to find out if there are plans to vaccinate those who have the antibodies. Also, as it relates to travel, if persons have already had the virus, will there be further testing and monitoring for antibodies where those persons are concerned? And number 3, parishes of Westmoreland, St. James, and Trelawney are now having the highest deaths. I'd like to find out what it is that they're not doing, that the others are doing. For instance, the hospitals in Kingston. Is there any reason why more persons outside of age difference are dying in St. James, Trelawney, Westmoreland, these parishes? Is there a different type of treatment that patients outside are being given?
Hi, Janet. Could you repeat the first question? We didn't hear you clearly.
In, to answer the first question, whether persons who would have had the virus in the past that were confirmed positive, if they would still be vaccinated, yes, they would be. The recommendation now, as it is that persons who would have had the infection would be vaccinated. The second question, in terms of travelers, whether or not they would be required to have a test done and whether or not we would follow them with antibodies testing. In terms of the requirement of the country, if we see for the United States, the CDC requirement is that for persons who would have had COVID-19 and would have recovered, a letter from their healthcare provider providing that information to say that they had a positive test, they were treated or were in isolation for the required period, those information can be used instead of a new test, a new negative test, because those persons may still have a positive test. So the letter from the provider is what is needed. In terms of the deaths, we have to remember that the deaths are the cumulative figure that has been from we started to have cases. So there would have been over time those deaths in those parishes. Some of the rates are because of the low number of cases in the parishes. For example, Trelawney would have a higher rate because of the population. It's a smaller population and a smaller number of confirmed cases, so their case fatality rate would be high. We also remember that we also had quite a number of cases in Westmoreland. Westmoreland and St. James, those have always been parishes that we have had focus on. So the large number of cases would have resulted in more hospitalizations and more severe outcome. So we have analysis is still being done in terms of the different treatments that are offered to see what treatments were offered for these cases and what are the outcomes related to that. But in terms of the overall numbers, it is really as a result, it's really a factor of the case fatality, which is a number of case deaths per the number of confirmed cases. And as I said, in Trelawney, low number of confirmed cases, so you have a higher rate. And for St. James and Westmoreland, would have had quite a number of cases there.
All right. Thank you very much, CMO. We're going to go to Nadine Wilson-Harris from the Gleno.
Hi, good morning, everyone. I have two questions. Just wanted to find out, first of all, has consideration been given to closing schools in Manchester to minimize the risk of exposure? I know that some schools have resumed face-to-face, closing it for the 2 weeks at least. And that's my first question. The second one, I wanted to find out of the labs that were mentioned earlier on that are doing PCR and antigen testing, how many of those labs are currently accredited? I noticed that last week when I checked, some of them said that they were only offering to persons traveling. I just wanted to find out what's the situation in terms of the availability of labs for persons locally as well, who are not traveling as well. Thank you.
Okay. On the issue of schools, the assessment is an ongoing one to the extent that we have had to tighten the restrictions in the parish. Clearly, a discussion would have started to take place with the Ministry of Education, my counterpart, the Minister of Education. That assessment will continue during the course of today. We do have a cabinet meeting today. And if in the assessment of the public health and the education fraternity in the parish, led of course by the ministry, there is a concern that would necessitate that decision, then that decision will be announced. But until then, it's a monitoring and sort of coordination of activities, and the need was not determined that that's the direction we should go, and therefore we continue to have face-to-face in those cases where they have been established. So we'll keep you posted on that. The other question was about labs. Labs and accreditation. I announced a number of labs that are now administering the tests. So that was contained in the report. In my accreditation. Oh, are they all accredited? No. You mean from a JANAX perspective? No. I can't tell you which ones are and which ones aren't. What I will say, though, is that the process that the ones that we've announced had to go through, involving the public health team, involving the training that PAHO collaborated with us on, would have seen these entities that have been announced meeting the standards to be able to administer these tests. And so they have gone through a process that we have coordinated and led, and we are satisfied that they are able to offer. I don't know if the CMO wants to add anything further to that. But it's a good question, and it's an important point to make, that these entities went through a process that involved the public health infrastructure as well as Pan American Health Organization in terms of training. I think you asked something about testing and where the average citizen could get testing. If you're willing to pay for it and you want it on demand, then you just need to go to one of those labs. If in the public health system there is an assessment done by a clinician that you should be tested, then the test is administered in the public health system. Sebo?
Right. I just want to say that we have been trying to increase the communication with the public in terms of testing in the public sector. We have increased the number for health centers that are doing testing, and we have increased the ways in which persons are able to contact those health centers to schedule testing. More health centers are utilizing the JAM COVID sites for appointment. So persons would just need to go on the JAM COVID, either the app or the website, and they would be able to see in each parish which are the health centers that are available for testing and to make an appointment. If it is that they are unable to get through using that method, then there is the telephone numbers for the emergency operations centers of the health departments that have been published several times, but we can put that out again. Steve, it's on the website. We can put that, it is. All right, so the contact information for the emergency operations centers, and they have the telephone numbers, and many of them have email addresses also that they have listed. So testing within the public sector is free of cost, and so persons this is available to persons who are having any problems in terms of complaints, flu-like illnesses, that they would want to have this checked out and to see if they need to have a COVID test.
Thank you very much, Semo. We're going to go to Amoy Harriet from NCU FM.
All right, good morning, everyone. So I have two questions. The first question is with regards to the medical practitioners who have been practicing unauthorized COVID antigen and PRC testing. So I want to know, because there was a call for those practicing illegally to come forward, is the ministry planning to sanction those individuals who do not come forward? And with regards to the second question, it has to do with the vaccination. Has there been any thought has there been any talk with how those persons are going to fit in socket? So are they still able to carry the virus, or will they still require quarantine?
So let me leave the clinical question to the clinician, the chief clinician, the second question. The first one on sanctioning. For us at this point in time, the sort of most effective sanction that we can administer now is through public education, and to say to the public, which we have done, that these are the approved entities. And when we say approved, as I said earlier, these are the entities that have gone through the training, that have been assessed, and that are found to have the capacity, whether it's equipment, personnel, or material, test kits that are approved, to administer a test with a fairly good, reasonable extent of accuracy. Others are there and are administering tests. There is no law, particularly if they are a trained clinician, a doctor, that would allow us to go in and to sort of confiscate what they have and to sort of enforce in that way. But we are hoping that the public will be aware, the buyer be aware, that's a critical principle of commerce, and that they will support those entities that are approved. And those that are not will seek to make right by making the contact, as we have announced, with the National Public Health Lab, to get those systems in place. And we're prepared to provide the support as best as possible for them. I'll ask the CMO now to speak to the issue, the other question.
Right. In terms of the vaccinated individuals, the information that we have is saying that persons may be able to transmit the virus still, even if they are vaccinated. And so therefore, persons who are vaccinated are still required to adhere to the infection prevention and control measures, which are the wearing of the mask, the physical distancing, the hand sanitizing, and environmental sanitizing, as well as to stay home if they have any symptoms. Remember that not everybody who is vaccinated will not get COVID-19. There are still a percentage of persons who will have the infection. And even though we have seen up to 95% efficacy in some of the vaccines reported, 5% of a large number is a large number. So there are still going to be a significant number of persons who may develop COVID-19. And so it is very important that you still adhere to the precautions. In terms of quarantine, it's very difficult at this time when we don't have all the information on all the vaccines. We have information so far on 2 vaccines, the Pfizer and Moderna, that indicates that for the Pfizer, it takes up to about 7 days for persons to start developing immunity, and for the Moderna, 14 days. So we know that, at least for these 2 vaccines, that there is going to be a period of time when, if the persons are exposed to the virus, that they can become infected because they have not yet developed immunity. So therefore, it suggests that quarantine certainly is going to be necessary for a short period of time. And when I say a short period of time, I'm talking relative to when the person had the vaccine, not the quarantine period itself of 14 days. So because we only have information on 2 vaccines already, and we await the information of the other vaccines, it is difficult for us as a ministry to set a rule at this time. We certainly are looking at it, where we are investigating the information and to try to come up with a reasonable period of time that would be able to allow persons, after a certain period have passed after they've gotten the second dose, or they have been fully immunized, because some of the vaccines will have one dose, to say that that is a period after which they will not require quarantine. But until we have more information and until we have made that announcement, the 2-week quarantine period remains in force for persons who have received the vaccine and travel to Jamaica.
All right, thank you very much. CMO, I have probably three questions from Prince Moore. He's asking, Dr. Tufton, how do you respond to the calls for the reopening of the entertainment sector? And what accounts for the delay in making a decision to hold some sporting events, namely football?
Okay, so to the extent that the agencies of the state, and I say agencies of the state deliberately because it's not just about the Ministry of Health. In terms of entertainment, the Ministry of Local Government and Rural Development, Minister Mackenzie, the Minister of Sports, Minister Babsy Grange, and of course, in collaboration with Health, are critical players as it relates to those types of events. It really boils down to a matter of a risk assessment and the events that may enhance the risk of the spread of the virus, and the protocols that are put in place, and the practicality of implementation of these events given the protocols that exist to control spread. We have been in dialogue along with our other ministries and ministers to examine these activities, and we have put forward in many cases proposals as it relates to an approach or protocol. I know that we have had starts and stops in terms of sporting events and approved, or a particular format for certain events to take place. But it's difficult. It's difficult in the and the same would apply for sports. It's difficult in the context of what is happening in the environment at a particular point in time. It's difficult in the context of just managing the spread of the virus, again, with the ultimate objective being not to become overwhelmed, or public health infrastructure, which is important to preserving life. And while we continue to have the dialogue, and we had one as late as last week with Minister Babsy Grange, a discussion around sports, the truth is that it really has to do with what else is happening within the environment and how we respond. What we will do in public health, the ultimate goal is to establish a set of protocols around, the physical distancing, the mask wearing, the numbers that congregate, that sort of thing, the sanitization stations and so on. And then the ministries that have direct responsibility, whether for sports or entertainment, will be the ones to interface beyond those, guided by those protocols, as it relates to which of these events would be allowed or otherwise. But again, I say the principle is the risk assessment and whether or not we can afford to make those decisions based on the risk at a particular point in time.
Thank you very much, Minister. He's also asking, we have seen where some schools participating in face-to-face classes had to be closed after persons test positive for the coronavirus. Is it prudent to keep face-to-face classes at this time?
Again, it is a function of the protocols that are put in place and the risks mitigating or mitigation activities around those protocols facilitate. We have to balance all the variables. In terms of our young people and school, they have been out for the most part of last year. There are significant negative consequences of that, whether mental health or their learning and development. And it was important for us.
The reopening of whether it is schools or business, I think what we have to stress is the confidence in your infection prevention and control measures. As a ministry, we have said over and over that if you maintain the infection prevention and control measures, then you're able to decrease your risk of exposure quite significantly. So if it is that you're wearing a mask and the person that is in the room with you is wearing a mask and you are maintaining your physical distance, your risk of exposure is going to be extremely low. And so these protocols must be sufficient, whether in fact I am positive, that it would decrease the chance of me passing on COVID-19 to somebody else, or whether I am in a room sitting beside somebody who is COVID positive, that I can be confident that I am not going to get it. My risk of exposure is very low. So it is the ability of entities to really put these measures in place and to have confidence in them, that even if it turns out that somebody is found to be positive, you can look and say that my infection prevention and control measures were in place, and so therefore my risk of exposure is low, and therefore my business, my function can continue. So it really comes down to, regardless of everything else, the maintenance of these measures. The other thing I would want to comment on is in terms of the educating the public when it is that I need to do a test for COVID-19 and what is the value of the test that I'm doing. Because you will go to different places and tests are offered. If you are without symptoms and you do an antigen test, then you have to recognize that you cannot rely on a negative antigen test, because the pickup rate of an antigen test in a person without symptoms is low. So therefore, it means that you still have to adhere to your infection prevention and control measures. Now that these antigen tests have become available, a lot of persons are accessing it through approved providers, some through unapproved providers, those that we have not had a chance to look to see if they're doing everything correctly. But you must not replace the doing a test with, and you getting a negative test, to think that it means that I am fine and therefore I can stop wearing my mask, I can stop having physical distance, I can go out in the public despite the fact that I'm having some mild symptoms. You must recognize what is the value of the test. The PCR test is a test that you can rely on more to have a good pickup rate. But even the PCR test, very early in illness, may be negative. And so therefore, we cannot replace the need for the infection prevention and control measures. Many persons are hurrying to do tests and are spending a lot of money doing these tests. And really and truly, what they really need to do is to stick to the infection prevention and control measures to prevent the risk of exposure and spreading COVID-19. In that we are unable to do our public health interventions.
My reason for asking that question, CMO, is to get to how you reconcile the emerging concern leading to a tightening of the COVID measures in Manchester, for example, and at the same time, your testing numbers seem constant daily. And I have a third question after this.
I'm not understanding the first question. Can you
I'm,
repeat
I'm,
it?
yes, I'm saying that your testing numbers daily seem to be constant. And at the same time, there are significant concerns with the COVID increase. So, for example, you're now tightening the hours for Manchester's curfew. How is it that there is such concern leading to extended or tightened curfew measures, and at the same time, your daily testing numbers are not increasing?
Our daily testing numbers overall would have remained at just about above 5,000 per week for the last couple of weeks. So you're quite correct in saying that there's no significant change when you average out the testing. But what you will find is that from parish to parish, the testing numbers varies depending on the surveillance activities that are being carried out. We start off with our baseline testing, which is, of course, case management and our general hospital surveillance and or influenza-like illnesses surveillance. That now determines what happens next. Because if we are picking up cases, then we go to contact tracing. If from contact tracing you're picking up more cases, then you go to community surveillance. So even though the overall numbers may not fluctuate greatly, especially if you look at it weekly, you will find that from parish to parish, the numbers vary depending on what is happening in that parish. So it averages out at just over 5,000 tests, but you would find that the numbers would change based on which parish you're in and what it is that is happening, what it is that the field activity is showing. Because if the field activity is saying that we need to step up, we need to investigate, then that's where we go.
Finally, can you say specifically, or probably the minister can answer this question, whether there will be any changes to the gathering rules for churches, in particular in Manchester?
Well, in keeping with the disaster risk management, the new order, I mean, the restrictions on numbers have been stated, 10. Do you recall if there was any exception? Huh? You want to comment on that? Just comment on it. Let me ask the PS to just comment on that one.
Good morning, and thanks for the question. Based on the enhanced procedures, the churches are not impacted by the increased restrictions in the parish. So the rules that apply for churches remain in place.
Thank you very much, PS. I'm going to go to Cassius Watson from Jamaica Social.
Hey, good morning, guys. Are you hearing me?
Go ahead, please, yes.
Okay, I have 4 questions. The first to the CMO. I've been noticing an increase in the number of deaths for people under the age of 65. I mean, am I noticing correctly? And what are you seeing? The next question, are JUTC workers included in the first batch of priority people to be vaccinated? My third question, and this is for the minister, what has been the effectiveness, you believe, or the feedback from the Christmas campaign? And finally, again to the minister, like what we've been noticing regarding issues regarding the pop-up testing sites, these that have not been verified or known by you, are you then concerned that you will also have pop-up vaccine sites? And you know, how you go about managing that? Thank you.
So with respect to the deaths,
Our chief epidemiologist, Dr. Webster Carr, will respond to the first question.
Thank you, Minister. So with respect to the deaths, there has been an increase in the number of deaths recently, and the spread is throughout all age groups. What is significant, though, is the comorbidities. All of the persons under 60 who have died, they have significant comorbidities. So they have hypertension, diabetes, kidney disease, sickle cell disease are some of that come to mind.
The JUTC, is it JUTC? No, as of now, no. But let me just say that the assessment around the who represents the frontline workers, I've gotten so many requests or inquiries, I should say, of persons who are suggesting that frontline workers are almost everybody who comes in contact with the public, which clearly would not be practical given the numbers of vaccines and so on. So it is an issue that we have to assess. Remember now, we are looking to try and get more than the 16%, and additional categories, if you will, of workers will be added to the list. But as of now, they are not on that initial list. Okay. The issue of the effectiveness of the campaign. I have my own thoughts, but let me ask the CMO to come in first, and then I, if necessary, come in after.
Right. So the Christmas, you called it the Christmas campaign, but actually our campaign in preparation for the spike that we were expecting in December, January, started in November. And if you recall the kind of spike that we expected to have in certainly now from the earlier weeks in January and December, we really did not see it. We saw a very gentle uptick in the number of cases, that we're still seeing that rise. But when we considered the takeoff point in terms of comparison to August, July, August, our takeoff point was much less at that time in the summer and than what we had in November, and yet we have not yet surpassed the number of cases that we have that we had in the summer spike. So there has been a success that we think in terms of decreasing the number of cases. We certainly don't think that we could have prevented an increase in the number of cases, but certainly the rate of increase, I think that we have made, the effort that we made have really paid off. In November, one of our strategies was that we really went all out, all our parishes, in terms of our investigation of our vulnerable communities. We saw what was happening across the world, where the number of cases in the old people's homes would have contributed significantly to their spike. And our aim was to pick up cases early, intervene early, and to prevent hospitalizations of this very vulnerable group, where we knew that if we had hospitalizations, it would have resulted in severe illnesses and deaths. So during the month of November and going into December, we visited almost every infirmary, nursing home, and we tested. And where we picked up the one or two cases that were for the most part asymptomatic, we were able to isolate those persons, manage those cases, and in part of that management was the establishing of the relationships between these homes and the health department, so that even later on in the month, whenever they suspected anything, the health department was informed quickly and was able to go in and intervene. So these measures, certainly our communication campaign, as we continue to increase awareness, the other strategy we had was that as soon as a community came on our top 20 listing, we would have gone into that community. That again caused that the majority of the cases that we were picking up through surveillance measures, and so therefore were not symptomatic persons, and we were therefore able to educate the communities in terms of the increased awareness of infection prevention and control measures. So the visibility that we had with our minister being in these communities and across the island, And the media campaign, we thought, increased awareness even more. A lot of persons say that people are not listening and people are not adhering, but some people are. And the fact is that it is because some people are listening and some people are adhering that we are in a better position than we could have been. So overall, I think that our campaign during the period of November and December has done well in terms of decreasing the number of cases. We only have to see what is happening in other countries that have similar populations to ours, that how their numbers have gone up, their hospitalizations have gone up. And it really is the tremendous effort of all the persons, the healthcare providers within the parishes that have made this difference.
Okay, let me just say in relation to the, and I say ditto to what the CMO has said, I think the team has done well and I really want to commend them for their efforts. In regards to the pop-up sites for vaccines, I want to just say that, like testing, I suspect that over time you will see persons or entities offering a solution to those who require vaccines as they are for those who require testing. And indeed, I think there's a likelihood that you'll have a sort of underground or black market, as some would refer to it as, offering these solutions. I really want to emphasize the importance of persons recognizing their role, their personal responsibility in supporting the legitimately recognized entities for these services. For starters, I certainly would not advise anyone to go take a supposed vaccine from an entity or individual without some legitimacy assigned to that entity or individual, because you never know what you're going to get, and that could not be in your best interest. The same should apply too for testing. And I understand the eagerness, the anxieties around trying to overcome the fears of the unknown, the fears of the virus. And I understand that persons want a sort of quick fix to the problem. The reality is that if the world had a quick fix, we would not have COVID-19 lasting so long and so many persons dying. There's no quick fix to this public health, global public health threat. Otherwise, the world would have found significant solutions and much more advanced solutions long ago. And the most developed parts of the world, with all the resources, we are all searching for a solution. And sometimes we, frankly speaking, are unfairly blamed or criticized in public health for not moving fast enough. And while I appreciate the need to move fast and to move as fast as possible, that has to always be balanced with the public health interests, with the lives of individuals who are at stake. And I think for the most part, we have moved at a pace that is an important balance between trying to find the solutions and at the same time protecting the interests of all concerned. And that's our primary goal. So just as testing would for vaccines, I think it's important that we recognize the information that's put out there and that we recognize our role in abiding by those critical protocols. Thank you.
All right. Thank you very much, Minister, and apologies to our media colleagues. There are a few more questions, but we have run out of time to ask those questions. So just give us your closing remarks, Minister.
Right. The time is getting on us, and I know we have a meeting now to discuss indemnity for vaccines. And of course, Cabinet. But let me just thank our media colleagues for coming on, for helping us to, in their usual way, to get this information out. Let me thank those of us on the team here who have participated, not just in this media briefing, but over the last couple of days in preparing for the brief. When we present, we would have done most of the work already in terms of the analysis and the write-up, so they have spent hours trying to pull all of this together. I want to recognize the team in the field for providing us with the important information, and in particular those in Manchester, the public health team and their support agencies, the constabulary, and others who are going to have to play an important role in the next 2 weeks to enforce the measures that have been announced. And to those in the parish residents, we want to urge you to please abide by the new restrictions in your own interest and in the interest of your communities. We will continue to provide updates as usual, and I believe that we are making progress despite the challenges. Let's work together to overcome COVID-19. Thank you very much, and have a good day and a good rest of week.